Okay. Are we ready, Jill? Are you all set?
I am, if you are. Yeah.
Okay. Yep. Okay. Welcome to day 3 of research speed dating. We've had a great first 2 days, so we're excited to kick off day 3 with our topic addiction. Um, I'm Beth Dolph with the Office of the Vice President for Health Sciences, and we've really enjoyed our conversations the first 2 days, and we're anticipating having some great conversation and making good connections today for today's topic. Um, we'll start with opening remarks from Jill, and then we will do our 1 minute pitch round. And then after that, we'll go into breakout rooms to have further conversation and discussion. And then we'll all come back together and we have a poll to fill out about future conversations and connections. And so with that, I will toss it over to Jill to introduce our topic today.
Thank you, Dr. Dolph, for everything that you've done to get this week going. My name is Jill Cizek, and I report to Dr. Brashear, not as the Dean of the School of Medicine, but as Vice President for Health Sciences. And Dr. Dolph originally conceived of this idea. We actually saw that this was an effective platform at a number of other research institutions to basically start connecting people on critical topics, especially when it comes to forming interdisciplinary teams. And I'll tell you that the last 2 days, credits to Dr. Dolph, have been extremely successful. People walked away with having met new colleagues, and we're very fortunate at UB in particular to have recruited a lot of talent over the last couple of years, which is exciting. And so it's nice to find a way to engage people in a quick and an easy way. The session today is more about the quality of what happens in the breakout rooms and our follow-up on it afterward. I assure you that you're going to have a poll that my colleague, Dr. Worrell, is going to run at the end of the sessions when we bring you back out of the breakout rooms that will give our office an opportunity to follow up with each of you and set up follow-up meetings. There's only so much that you're going to be able to discuss in 15 minutes within each of these groups. The breakout rooms, we have 3 that are set up. We have one based on basic science, one on clinical topics, and then we've also created a breakout room if anybody wants to engage in discussing any sort of community engagement or programming type opportunities, because we recognize that that is just as much of an element of the research university as anything that's going out into publication. I think some of you probably know, but UB has a great history in addictions work, and not only from the hard science side, but also the social sciences. So we have great examples. The Research Institute for Addictions was founded in 1970 as was one of the first federally funded centers dedicated to addictions research. One of the key team members of that effort over the course of years was Dr. Collins. Many of you may know her as the Associate Dean for Research in the School of Public Health and Health Professions. But Dr. Collins has a very distinguished career on behavioral interventions as related to addictions and specifically alcoholism. We've got other faculty who might not have been able to jump on today because of clinical workload, but Josh Lynch and Brian Clemency are doing great work out of the Department of Emergency Medicine on assessing the impacts of substance use and risk. It would be poor for me not to mention that even though this is being delivered via the health sciences, we look at these topics in a very interdisciplinary way, even beyond. And so we have great colleagues, even in the College of Arts and Sciences, and a person that I've worked with over a period of time on a bunch of different committees, and he's been very generous with his thoughts on anything that we've tried to plan with addictions is Dr. David Herzberg, who basically has a lot of scholarship that reminds us that addictions are way beyond just the effect on the individual and how it shapes how we understand all of the different elements of our society. So there's so many great things to discuss on the topic. I don't think this is the only time that we'll do this, but I think it's a really great start to the conversation. We have some symposium that we've planned in the past that have been extremely effective, and we'll probably circle back to that. And the last thing that I would say before you go into breakout rooms is that I look at this from an administrator's vantage with three different things in mind. My doctoral work was all tied to science policy and team science. And so we're always looking for ways as to how we can connect researchers to formulate teams to go after really tremendous solutions because they're coming at things from an interdisciplinary perspective. So if you think about it that way and how we can build something, I would say if you bring into those conversations anything that you've seen out there that's an RFP for something that you would have liked to have pursued, but perhaps didn't have the team put together, that would be a good thing to keep in the back of your mind as you're going into the breakout rooms. Also keep in mind that there are opportunities on campus, either through the office that I'm situated in, the Vice President for Health Sciences, or at the level of the Vice President for Research, where we can invest into groups, and whether that means forming a new center for teams to come together, or what I have done, I think 3 or 4 times now over the last 2.5 years, is find seed funding for people if they have a concept that they would like to prove out because there's an opportunity that's out there federally or in another funding landscape. We know that a lot of times if you're forming a new team, you're going to need some preliminary data, and sometimes that comes with a cost. And so I would keep those things in the back of your mind, because I wouldn't think that seed funding is off the table, or that forming a more formal group is off the table. I will wrap and say the poll that Dr. Worrell is going to push out at the end of this, because I have to jump off. We're all going in different directions today. Is going to ask you if you'd like to meet again. It is the responsibility and the pleasure of our office to help organize those sessions. We'll get you started. The last thing that we want to do is have a really impactful day, have great conversation going on, and then put the burden back on you as investigators to try and schedule yourselves and figure out what's the next best way to get together. So once you answer that poll, we'll get back to you. We'll put out some polling. A wonderful colleague of mine, Linda Christiana, will create a rally poll, and then we'll get the next step of this going. And then we'll engage other campus offices as well, like the CTSI, if there's an opportunity, especially for the people who are interested in the clinical space. So I thank you each for taking the time to be here. And again, Dr. Dahl, thank you again for organizing. And with that said, I'm interested to hear what everybody has to pitch on. So
Thanks, Jill. So we'll start our pitch round, and I believe I saw Dr. Shen, you're first on my list, so it's all yours.
Okay, I stumbled into the addiction field because I'm doing some research work on fetal alcohol spectrum disorder. So these kids actually have increased addiction risk. So recently, we actually submitted a drug development grant and received it is received very well. So I'm just thinking about the future, and I hope to know that there are people at UB doing, this kind of clinical trial work. So that's my main goal here. So.
Great, thank you so much. Dr. Bass.
Hi. So my background is in behavioral pharmacology and behavioral neuroscience and preclinical models, so mice, rats, some non-human primate. I've spent a lot of time over the past few years looking at specific brain circuits involved in reward-seeking behaviors and drug-seeking behaviors. I have a specialty in designing viral vectors for specific manipulations in the brain. So there's some gene therapy aspects that may factor in. What I'm most interested, I guess, in this working group is maybe getting to know some of the people who are involved with human work a little bit better, and seeing how that meshes. I love seeing scientific groups that involve both the basic research and the more translational aspects. So that's pretty much where I lie and what I'm looking to gain from this.
Thank you, Dr. Bass. Dr. Wen.
Okay, great. Hi, everyone. My name is Xiaozhong Wan. I'm a associate professor in the Department of Pediatrics, Division of Behavioral Medicine at UB. So my background is more from the public health, like especially epidemiology. So before I joined UB, I did a lot of work on their observational research to see how maternal use of tobacco products and also second-hand smoke exposure during pregnancy may impact their offspring outcomes, such as growth, obesity. Um, so after joining UB, I continued that part of work, but I gradually also transit to clinical and translational research. Specifically, we develop a smoking cessation program for pregnant individuals. So from there, we expand to do use of cigarette, e-cigarettes as well in the recent years. So that's what we do for their smoking cessation. Right now, we have a few funded projects. One is to use postpartum breastfeeding promotion as a strategy to prevent postpartum smoking relapse. The other one is a pilot study to do the cessation of cigarette, e-cigarettes. So I look for collaboration here and learn some new research from you guys too. Thank you.
Thanks, Dr. Wen. Dr. Oldani.
Hi, everyone. I've met some of you in the past. I'm the executive director of the interprofessional program here on campus. And I'm here today because we're often thought of as a great curriculum pathway. We take 16 programs and get students prepared for team-based care when they leave UB, including medical students, pharmacy students, so on. But we're in the process of securing a special volume for the Journal of Interprofessional Education and Practice. And I'll be a co-editor, so I'll have some editorial sway on what we can include in that special volume. And we do have a robust history of research here in IPE. The topic is interprofessional approaches to medication management and deprescribing. And so for clinical people, that's pretty straightforward. But what I'm also looking for are some basic scientists and research scientists that are interested in perhaps putting together an article on team science. That's an aspect of IPE, I think, that's under-theorized and under-connected, for lack of a better word, with sort of the clinical world of IPE. So that special volume's in 2027, and I'll be doing a call out as soon as we finalize the abstract. But I thought with this kind of work on addiction, it speaks really well for deprescribing. And some of my work in medical anthropology has been on deprescribing benzodiazepines and other addictive compounds. So I hope to connect with people that might be interested in contributing to that volume across a range of related topics. So thank you.
Thank you. And Dr. Lazarus.
Good afternoon, everybody. I'm Phil Lazarus. I've been at UB since summer of 2024, so relatively new faculty. My research background is primarily in the field of tobacco and drug metabolism. And we've done a lot of work on nicotine metabolism, looking at biomarkers, not only of tobacco-related cancer risk, but also of addiction to nicotine. We've also, in the last few years, been looking at the role of cannabinoids and their potential role in drug-drug interactions with drugs of addiction, not only nicotine, but with opiates and benzodiazepines. So I'm looking to collaborate. We've have a number of not only lab-based studies, but clinical studies as well. So we span the research realm from epidemiology into clinical studies and molecular biology, as well as mass spec work. So if there's anybody who's interested in collaborating in any of these areas, I'm happy to discuss.
Great, thank you. That was everyone that I had who had signed up to pitch. Did I miss anyone, or is there anyone who would like to jump in?
I'm Dr. Bansal. I had signed in, but maybe I signed in too late. Um, I did chronic pain management. I had chronic pain management practice for almost 40 years. I just retired, and I found that there's a lot of interaction between addiction medicine and pain medicine. And since I retired, I have donated some money to UB, about $250,000, to teach addiction and pain medicine to undergraduate and also graduate residents, attendings, medical students, how to take care of pain so that we don't create addicted patients. So right now, there are two projects that are in progress. One is in the Department of Family Practice, and other one is uh, uh, medical school for teaching medical students.
So if I can, I know, sorry, Beth, don't mean to throw you off because I know you have other people who want to pitch that chimed in on the chat. Dr. Bonsall is being very modest, not only on her career achievements, but also her generosity. And so we have projects on campus right now that people are actively pursuing as a result of her generosity in the pain management space. And so I think thank you, Dr. Bonsall, for taking the time to join the conversation today. Good to see you.
Pain and addiction. It is not just pain.
Agreed. Yeah, you know your space better, but just thank you.
Great, thank you. Let me go to the chat. Great, Dr. Zhao.
Oh, sure. Hi, everyone. I'm Rogang Zhao. I'm a professor in biomedical engineering in engineering school. So what we do is we develop this microphysiological system or organ-on-chip systems for drug testing. And I'm interested. I'm a tool developer. I'm a technology guy. So I'm looking for a clinical and then we also have we also have these neural organoids, brain organoids that are developing in the lab. So I'm looking for a clinical or neuroscience collaborators who can ask the right clinical question related to addiction. So I because we have this neural sort of a micro neural, on chip systems that we can use to testing some of the drugs or therapies that for addiction related problems. Thank you.
Thank you. Dr. Mangione.
Hi, I'm Will. I'm a postdoc in the Department of Biomedical Informatics, and we've been working on a project developing a novel treatment for opioid addiction. And our theory about how we're going about it is a multi-target drug that targets different receptor pathways in the brain. And the way that we came about that is targeting the various hallmarks of addiction, so to speak. So withdrawal, the binge or reward phase of addiction, as well as craving circuits that go awry in the addicted brain. So we have a project that was funded through the STTR mechanism with a company that we formed, and we're continuing that work now. We have some more funds to pursue development of at least one really exciting molecule that we have, but not really sure what I'm looking for. There's many different things. I'd love feedback on the overall approach that we're going for, but also just would love to know what everyone else is working on, if there's any opportunity to collaborate.
Thank you. Anybody else before we go into breakout rooms? Okay, I believe if you look at the bottom toolbar on your Zoom, you can click on join breakout room.
Yep, they're open.
And yep, they're open. So you can decide which room you want to jump into: basic science, clinical topics, community engagement, and programming. So you can do that now, and we will call you back in a little while.
We'll give you a 30-second warning.
And you can also move from one room to another. You're not obligated to stay in a particular.
I don't see that link for some reason. Maybe I'm not looking in the right place.
It should be across the bottom, like where the share and the chat icons are.
It
There
could
Yeah,
be
should be
under
one, it's
more.
like it's 4 squares and it
under
says
more.
join breakout. Or that's what I see. Or click the 3 dots that says more.
Sometimes you have,
I got it. It's
sometimes,
under more. Yeah.
yeah,
Okay.
depends on how big your
Okay.
screen is. It's
Got it.
because,
Nice.
yeah, you're probably squished together.
Sounds good.
We're back.
Welcome back, everyone. I think I'll give it 10 more seconds to make sure everyone else made it. I hope everyone had a great conversation. And like Jill mentioned, I'm going to launch a poll for you guys to fill out some information. And if you're interested in reconnecting, this poll will allow us to know that you want to do that. And we will be able to have a team member set that up for a future connection. Launch. And if it doesn't auto pop up for you, it would be along the bottom bar of the Zoom screen or under more. So if you wouldn't mind taking a moment, we would very much appreciate that. I'd like to thank Dr. Dolph for this wonderful opportunity that she's provided throughout this week for our lunchtime speed research dating. You're more than welcome to hop onto any of the remaining ones. You don't have to do a pitch. If you're just interested in learning more about some of the other topics, feel free to just sign up to join for that. Is there anything else, Beth or Dr.
Yeah, tomorrow's topic is oral health, and then Friday is chronic conditions. So if you're interested, you can hop on. It's the same Zoom link. You don't need to sign up if you don't want to pitch. So you can just feel free to join in. And I would just thank you all for coming today. And I hope that I hope it was a fruitful hour that you spent making connections and hopefully some great ideas, found some great partners. That's the goal for the week. So thank you all so much.
Yeah, perfect. Dick, thank you guys for organizing this amazing event. So I have a question about the follow-up. So I just submit my poll responses. So will you guys like create some like say email group for us to further conversation, or we can do that by ourselves?
You're welcome to do that by yourselves, but I think the intent is with the poll that we'll have your information and those that are also interested, and a colleague will create either another session, like by doing availability polling, see when another one could be held for the interested group, and I maybe even email connections if that needs to happen. We can certainly assist with that too.
Oh, perfect. Yeah, we hope. I wish we had more time.
I know it's not a lot once you get going.
Yes, we had a great fun to talk with each other. Yeah, amazing. We have a lot of wonderful researchers. You'll be with us, shared in research. We should take advantage of that.
Yeah. And like Jill said, like we don't want it to end here, so we are happy to facilitate further conversations and connections.
Perfect.
Also,
Look
Professor
forward.
Lazarus has experience of the program grant. Professor Philip Lazarus in the Department of Pharmacy is the division chief, and he has experience of the program grants. So we can build it up here one by one. We can build it up here.
Thanks, Bhaskar. I appreciate that.
Yeah. I am also working with you and working also Professor Sen with the alcohol use disorder and also nicotine. So 2 addiction area I am working. So my expertise is give the molecules. So I am here.
Perfect.
Thanks, everybody.
Thank you, everyone, and thank you, Dr. Dolph.